Hi, woman. If you got this far to listen to what I have to say, I can safely assume that you care about your pregnancy and birth. You want to make the best choices for you and your baby, and that's really amazing. You're already one step ahead into the beautiful journey of growth, self responsibility, and motherhood. You're probably a person who cares about your health and your well being, and you want to have a birth as natural as possible. That's probably why you are already familiar with the work of midwives and maybe even why you have chosen to be under the care of a medical midwife at your local hospital or as you plan for your home birth. So I want to start off by saying that I love midwifery, okay? I appreciate the work of midwives so much. They have walked with women from the beginning of times and they ensured women were supported and taken care of during childbirth. But I have to be very honest and transparent with you. Midwifery today is very far from what it used to be 100 years ago. Most midwives today are medical practitioners. They're trained by the obstetric medical system and they work for the state, which sadly imposes lots of rules and regulations into their practice, increasing their fear and interference in pregnancy and birth. So the word midwife, which means with woman, is no longer that, as now midwives have to choose between serving the woman or the state. So I'm here to be brutally honest and share some very important facts about pregnancy and birth that your medical midwife is not sharing with you and that you must absolutely know. So let's talk about informed consent. Informed consent is the process in which a healthcare provider educates a patient about the risks, benefits, and alternatives of a given procedure or intervention. It is the obligation of the provider to make it clear that the patient is participating in the decision-making process and avoid making the patient feel forced to agree to the provider. Now, let's be honest. Most providers are not doing this today at all. I can say this because I am 100% sure that you haven't heard from them what I'm about to tell you. And I want you to have full knowledge and understanding before making serious decisions for you and your baby during this pregnancy. You cannot afford to not know about this. It will come at a high cost to you and your baby, and that's going to affect you both physically, mentally, and emotionally. So for that, thank you for sticking around to watch this. So the first thing your medical midwife isn't telling you is about the dangers of ultrasound and Doppler use. Ultrasound uses sound waves to produce images. You probably already know that. But did you know that ultrasound can change cells and tissue? Did you know that it has proven to actually modify cellular growth and therefore affect cellular development? It can affect your DNA and your baby's DNA. It has been proven by numerous animal studies. And with the increased use of the normalization of Dopplers by medical professionals and by mothers themselves, babies are now exposed to this dangerous technology very early on and with a high frequency. The so-called non-invasive device called Doppler is actually very invasive. Some studies are suggesting its connection with autism and dyslexia. Also, did you know that it is a digital enhanced replication of a baby's heartbeat with a high frequency than a regular ultrasound? So you're actually not listening to your baby's heartbeat. Not only are ultrasounds harmful, but they tend to give wrong diagnosis all the time. You know the story. Your 10-pound baby mysteriously was born 7, 8 pounds. Or that weird growth on your baby that after many more ultrasounds mysteriously just went away. Or the placenta previa that wasn't previa after all. I mean, the list goes on and on. Ultrasound doesn't improve outcomes. It increases fear and the authority of medical professionals over your body, your pregnancy, and your baby. It increases interventions and surgeries. The harm is also on a collective emotional and human level. Mothers are now being taken down this road of disassociation from their babies and intuition and into a deeper connection and trust for technology and medical system. It's like we can only bond with our babies after we see them on a screen. This is not the best for us human beings. Our ancestors had a deep spiritual, physical, and emotional connection with their bodies and their babies. So please, Really consider all of this before allowing any physician to use this device on you during this pregnancy. The second thing you need to know is that the estimated due date, EDD, is a scam. Yes, that's right. Instead of being used as just an estimate, they're actually being used for the purpose of eviction notice. Due dates are great for medical professionals. That's when they get to intervene with diabetes and, testing and GBS testing and ultrasounds and find all types of issues with you and your baby so you can get an induction or schedule a cesarean. With my own experience with women who are not allowing the pressure and fear of due dates to interfere with their initiation of birth, they're giving birth freely and powerfully, some even at 43 and 44 weeks. They know that it's best for them and their babies to allow the biological process to unfold on its own. Are you willing to shift paradigms around pregnancy and birth? So what if instead of saying my due date is December 15th, you said my baby's gonna be born sometime in the winter? I like that so much better. What would it look like if you didn't have any pressure to go into labor? What if you decided to instead listen to your body and to your baby and be at ease? What if you follow the moon cycles to count the months into your pregnancy like my grandmother used to do? I will never forget being 40 weeks with no signs of labor and receiving the eviction notice from my OB. My grandma said on that day to me, Nara, it is a full moon. If your baby doesn't come now, it's because it's not time yet. She's gonna come on the next full moon. There's so much sacred wisdom, sacred and lost wisdom in those words. If only I listened, if only I shifted my mindset and paradigm, I wouldn't schedule that unnecessary cesarean. If only I knew then what I know now, but you can. And that takes me to the third information you must know, which is that your induction is much more dangerous than any of the risk factors they are associating with you and your baby. Please listen to these facts based on data. Women who are induced are twice as likely to deliver by cesarean. Induction increases the chances of a longer pushing stage of labor and of an instrumental delivery like forceps and vacuum. Prostaglandins drugs can cause intense uterine contractions with higher risks of uterus rupture. Babies who experience artificial rupture of membranes or breaking of water are more likely to show signs of distress on heart rate monitoring. It may also expose the baby's head to greater and more even mechanical stress in labor because the baby's head no longer has the protection of the amniotic sac. Induction with drugs will cause blood and oxygen supplies from the placenta to be more compromised than usual during contractions, which means the baby will have less time to refuel in between. More induced than non-induced babies show a low Apgar score and also require NICU care. It increases the chances of postpartum hemorrhage, infections, and cord prolapse. So you can begin to tell me that this is all better than just waiting for the baby to signal that he or she is ready to be born. With inductions becoming so normalized today, you are seeing an increase in health issues and emotional trauma associated with mothers and babies that cannot be dismissed anymore. So if you think or thought in the past that it is insane to schedule an induction just because you're 41 weeks, you are right, it is insane. To the woman who thinks that she could easily be 40 weeks instead of 42 weeks and that this should be considered before the induction, you are so right. To the woman who is tired of being harassed or feeling in captivity of the fears and limitations around birth, there is another way. Remember, I told you there were women giving birth at 43 and 44 weeks to healthy babies. Imagine the risks for this mother, especially for this baby, if an induction was performed at 39 or 40 weeks. That's almost 5 weeks prior to the time that that baby was supposed to be born. Yes, I think we need to stop normalizing this initiation into birth through medical drugs and medical procedures. And I believe every mother needs to know the true facts about inductions. Now, the fourth thing your medical midwife isn't telling you is about the dangers of the nocebo effect. The nocebo effect happens whenever a health professional does more harm than good by interfering with the belief system, the imagination, or the emotional state of a patient or of a pregnant woman. Oh, yeah, this happens all the time at almost every prenatal appointment under the medical system today. The nocebo effect is based on constantly focusing on potential problems. That means that every visit is an opportunity to be reminded of all the risks associated with pregnancy and delivery and to be tested. Sounds familiar? Michel Odent, a French obstetrician, states that the vocabulary used with mothers can dramatically influence the emotional state of a pregnant woman, and it shouldn't be done. The term gestational diabetes is the perfect example of that. When analyzing the most common reasons for phone calls by anxious pregnant women, he has found that more often than not, health professionals are ignorant or are misinterpreting the medical literature. When it comes to gestational diabetes, for example, they lack understanding and respect for one of the main roles of the placenta, which is to manipulate maternal physiology for fetal benefit. That means that the fluctuation of the sugar levels in the blood is perfectly normal and actually optimal in pregnancy. The last thing a pregnant woman needs is fear and worry. The nocebo effect can cause a mother to develop anxiety, depression, disconnection with her baby, and all that affects her hormones, which then can cause a mother to go into preterm labor, to have a stalled labor, or to have postpartum depression. It shouldn't be standard to test women for gestational diabetes or GBS, for example. The more testing is done, the more reasons for a possible issue is going to be found, and it's going to cause the mother emotional state to be impacted in a negative way. Your midwife is not telling you this because she has been trained to find issues with you and your pregnancy. The obstetric care system or industrial childcare doesn't look at individuals' personal needs and health. It looks at them as customers as a whole. It's a business and it needs to make lots of money to get the machine to keep working. So they're going to find reasons to make more money. And we all know that pregnancy that is left alone on its own to take its course, it doesn't make them any money. Instead, what you need to do during pregnancy is to stay away from anything or anyone that brings you fear and worries. You need encouragement and you need to be constantly assured that your body is healthy, that you can listen to your intuition, and that birth is a spontaneous biological process that can bring you bliss and power. Unless your body will show major signs and symptoms of something being wrong, there is nothing that needs to be done. The last thing you need to know is that cervical checks are not necessary. They cannot tell us when labor will begin, how long labor is going to last, or when it's time to push. Not only that, they are harmful in so many ways. They can increase drastically the chances of infection to you and your baby, and they can stall your labor. They can cause even more pain. I would go as far as to say that cervical checks are part of rape culture. Rape culture is a society or environment whose prevailing social attitudes have the effect of normalizing or trivializing sexual assault and abuse. Do you think there's sexual assault in cervical checks? Absolutely. Unfortunately, I have witnessed this with my own eyes, and I know that if you have had a baby before, you have experienced this. We have normalized cervical checks, and no one is talking about how it affects labor in women in a very negative way. The medical environment, whether at home with a midwife or at a hospital with an OBGYN and nurses, has made it normal and expected to allow hands and fingers up women's vaginas. And no, most of the time you don't have a say in it. They will manipulate, fear, induce you, and force you to get their way. Your cervix is not a crystal ball that can tell them what to do next to accelerate the process. Your cervix can go from 3 centimeters to 10 centimeters in minutes. Also, your cervix is very connected with your emotions, and many women describe a total disconnect with their bodies, the labor process, and their babies after they receive a cervical check. It can be very traumatic if you have had any sexual trauma. This is especially harmful to you. The truth is that doctors and midwives are doing cervical checks to assess birth women and see how long they need to be there for. What happened to just allowing women to just give birth undisturbed? Women need to feel safe, comfortable, respected, and free. That's how the hormones of birth flow and the cervix opens up and dilates. So make sure you protect yourself from this procedure as much as you can. Educate yourself on your choices and choose a path that will be as natural and peaceful as possible for you and your baby. So here's the thing. I gave you only a fraction of the information I have that can help you have a natural birth that is powerful, blissful, and safer from interventions. So, after listening to me, you now have two options. The first one is to do nothing and go on with your life in pregnancy the way you are now. That's okay. Maybe this is too much information that you aren't ready to receive now, and you think the best thing to do is to go back to blindly trusting your provider. Maybe you're now looking to really dig into the truth and take self-responsibility for what happens during your labor and birth. So you will continue your prenatal care the same way you are now, and you get to find out for yourself if birth can really be that bad under the medical system, and if those interventions can really cause that much harm for you and your baby. Or the second option is for the woman who, after watching this video, realizes that the portal has been opened and your mind is blown with all this incredible information. It makes sense to you and it feels right to you, and now you need to know more. And you want to make changes that will make this pregnancy and birth better and safer for you and your baby. Maybe you have experienced all that I mentioned before with your previous birth, and you know it's true. You always thought that your doctor or midwife were withholding information from you, and now you want to swim in the ocean of knowledge and get the support you need so you are not alone in this journey. You're ready to experience birth in the way our ancestors did, and you just need extra coaching and guidance. Well, if you're really serious about birthing power, then I have a service that will absolutely delight you. It includes 8 sessions with me where we can debunk all the myths surrounding childbirth, and I can use tools that will heal you, prepare you, and guide you to have an absolutely peaceful and empowering birth experience. If this is you, go ahead and click on the link below and book a free strategy call with me. Yes, that's right. I will chat with you for 15 minutes for free. Hear what you have to say and see if my services are for you. I can't wait to connect with you.